Valley's Making Rounds Live. Broadcasting and streaming live from the WIDU Community Room.
The WIDU Radio Network, WAGR in Lumberton, WIDU in Red Springs, WBWO in Lawrenceburg.
Making Rounds Live on 99.7 FM, 1600 AM.
We air every second and fourth Tuesday of the month. Making Rounds Live. The purpose of this show is to bring you information on health and wellness.
Here's the host of Making Rounds Live, Omega Jones.
Thank you so much, Ray. Welcome back to another episode of Cape Fear Valley Health's Making Rounds Live. I'm your host, Omega Jones, the trusted voice that connects communities. Thank you so much for joining us today. On Making Rounds Live, what we do, we connect physicians and healthcare professionals that are working to keep our community safe and healthy. And with students heading back to traditional school next week? Today we're talking about something every parent needs to be thinking about. Making sure their children are healthy and ready for the next school year. Now, let me go ahead and put this disclaimer out since there are a couple of things that we're going to be talking about during this hour. Remember that this is not a time for you to self-diagnose. This broadcast is for educational and informational purposes only. If you suffer from anything that we may discuss today, later on in the broadcast, please find yourself a healthcare professional. Now, ladies and gentlemen, joining us today, Dr. Andrew Troxell. Dr. Troxell is a resident physician at Cape Fear Valley Health, and he is here to talk about childhood vaccinations, those school requirements that your child needs, and to give you some practical tips to help families prepare for a successful school year. So, Dr. Troxell, first, welcome to Making Rounds Live.
Thank you for having me.
First, Dr. Troxell, who is Dr. Andrew Troxell, and what is your role at Cape Fear Valley Health?
I work in the psychiatry department at Cape Fear Valley. I am a resident there, completing my 4th year of psychiatry residency, which is part of the extensive process of training to become a board-certified physician. This year was actually my 25th first day of school, so I've been going through this process for a really long time.
You look 25th day. You look like you're 25 yourself, Doc.
Thank you.
Back to school season, as you mentioned, it's already upon us. You've already done 25 of them. Why is this such an important time for families to focus on health?
The first part of that is that there's a pretty big shift between summer vacation and going back to school for kids and families with different schedules and activities that are happening throughout the summer and going back to the school year. That can have a lot of psychiatric effects on children as that routine gets changed, both going into the summer and coming out of the summer. And it's a really important point to focus on issues that may come up during the year and get ahead of them. So picking up on any sort of medical concerns that haven't been diagnosed or treated or seen yet, that can happen at an annual visit, back to school physical. And the other part is that when you re-enter the classroom, it's likely a different group of students than you were working with the year prior. And that comes with all sorts of new challenges, medically, immunologically, being exposed to different diseases that are getting spread in that classroom environment. And so preparing for that and getting your body ready to go back into that environment is really important.
A lot of people, Dr. Troxell, they wait to the last minute. I was guilty of it when my kids were in school. When should parents and families really begin preparing for those back-to-school health visits?
Before now.
Before
with a week out till school, it's a little late for that. If it hasn't happened yet, make sure to get it done. But some of that depends on the family situation. You know, if it's hard for the family to schedule appointments or make time for that, that's going to require more planning. If there are other issues to address or there's multiple doctors involved in a patient's care, a child's care, then that's going to take more appointments. It's something to start looking at the end of the school year, getting appointments scheduled for the summer in case there's something that does come up. So if there are vaccines that need to be caught up on, or if there's something like a hearing or sight issue that gets detected, diagnosed, during that initial visit, it may be that they need to go see an eye doctor now, and the point in time at which they'll be able to get glasses for the coming school year is months after that first appointment. So making sure that you're giving yourself time not only to get that appointment in, but if there's any sort of need for follow-up, that you can get that done in the time frame too.
Dr. Troxell, okay, school supplies, check. New clothes, check. What health-related things should parents and families have on that back-to-school checklist?
There are a couple of things. The first is going to be getting updated to a vaccine schedule, making sure that everything's up to date to go back into that classroom and be exposed to any new diseases that may be spreading through the school that year. You want to have an annual physical, a well child visit for children before they go back to school to check in on things and make sure everything's up to date with that. Any sort of health and or sight, hearing screenings that need to happen, you want to get out of the way. And then if your child is on medications or there are medications that are starting, you want to start that process a little bit early to make sure that the school is updated with that. Some of that can take a little bit of time to get everyone on board with to make sure that the child is able to get their medications, especially if there's something that's going to be given around lunchtime.
The traditional school year is upon us, ladies and gentlemen, and today's broadcast is all about getting you prepared. Today, Dr. Andrew Troxell, he is a resident physician at Cape Fear Valley Health. He's our in-studio guest today on Making Rounds Live. Dr. Troxell, let's talk about vaccines. They're on the news. Always a big topic, especially this time of year. What is staying up to date? Why is staying up to date on those vaccines so important?
It feels like they've always been making the news recently. And I think some of that comes from that they're a little bit mystical or a little bit magical. It's this thing that doesn't really treat something that's going on. You typically don't feel a whole lot different after you get it, and the effects of it are going to last potentially for the rest of your lifetime without you really knowing that that's what caused the protection that you had. And vaccines treat two groups of people. The first is the person that receives the vaccine, and the second is the community as a whole. Getting up to date on those vaccines protects you from the diseases, the pathogens that we've identified that are in the vaccine, but it also protects people that you may expose that to if you get that pathogen and spread it. And what we see a fair amount is that there are often carriers of diseases, where somebody will get the infection, they may not even know that they have it, and be able to spread it to other people during that window. And so kind of having an outlook of, oh, I'll stay home if I get sick, or I'll avoid other sick people, doesn't really work in practice because you don't always know if you're sick. Even when people do show signs and symptoms of infectious illness, it may be that they have been infectious to other people for days or potentially weeks prior to showing any of those symptoms, which is why the prevention of it is really important.
What vaccine, for the state of North Carolina, what vaccines are required before students start school?
Well, this is changing in the news
Exactly,
today.
it's
so,
changing right now.
My information is not going to be the most up to date.
Okay.
The big guidance is going to be to talk to your pediatrician. You know, regardless of what happens with recommendations from the federal level, the guidance really is always going to be to listen to that doctor that you've developed a relationship with that is able to take in all that information at a level that goes beyond press conferences and into looking at the research and information about it out there and helping you make that decision with it. So in the coming future, there may be vaccines that were recommended in the past that under the current administration are not being recommended now, but work with your physician to determine whether those are right for your child, because the diseases don't stop, they're still out there. And so when there's changes at that level, it doesn't really affect what's happening on the ground.
Vaccination requirements for students transitioning from elementary school to middle school to high school. How do those requirements change?
Part of that goes into those groups that you're protecting. In infancy and early childhood, one of the big focuses on preventing those childhood issues that can kill or injure children for the rest of their lives. As you get into adolescence, there are some other diseases that are more common in that group that happen more with that contact in the classroom or in sports. and a new set of vaccines is recommended during that period. The meningitis vaccine is one of those that's recommended.
Which vaccines are recommended even if they aren't required by the school?
Pretty much anything that the child's going to be exposed to. And one of the big ones is the flu vaccine. The flu is something that we've pretty much normalized as a culture, happening every year, but it kills 12,000 to 50,000 people a year. And a lot of those people are in that group that are not getting vaccinated for whatever reason. Maybe they've never been vaccinated for the flu. Maybe they're immunocompromised because their ongoing cancer treatment is preventing them from being able to get a vaccine, or other medications that they take prevent them from mounting an immune response and really being able to take the benefit from a vaccine. Flu is a disease that changes every year. You may hear the H1N1 and variants of that, and that's because there's all these different flu strains that switch parts between them. And so when you protect from one specific strain, you're not necessarily protecting as well from other strains. You may get a partial match to that. And it changes every year. We actually look at the other side of the world and see what the flu has been doing the past half year and develop a new flu vaccine based on that to offer better coverage. Flu is really important because it kills all of those people. Flu vaccine protects about 12,000 people a year. It is about 50% of the population gets the vaccine every year. And if everybody were to get it every year, we would actually see an even higher amount of protection, because when diseases are protected against in the community, that herd immunity that gets talked about, it's harder for it to spread, and unvaccinated individuals, people that can't or won't get vaccinated, are protected because they're not being exposed as much, whether it's those silent carriers or people that are exhibiting symptoms. Keeping up to date on COVID vaccinations, it's still around. It's getting milder over time. The way that the virus is mutating and changing over time encourages it being spread potentially more, but being less lethal. The result is that it can spread for longer, and over time we see diseases like that get a little bit milder, but it's changing. The initial vaccines you got may not still be protecting you as well. We see some decreases in resistance to diseases even when they don't change, just as your body ages. And when there are changes that are happening, that decrease in effectiveness decreases even more. The other one to consider is the HPV vaccine. There's actually a vaccine that prevents cancer. And we've seen remarkable decreases, specifically in the rates of cervical cancer, with this vaccine being introduced and taken up by the population. It's kind of wild to think about that a vaccine you get now can prevent cancer 50 years in the future. A lot of people kind of write it off as a sexually transmitted disease, HPV, that won't affect my 12-year-old child, but you're not setting them up for protection in the next 5 years. You're setting them up for protection during their lifetime. And what we see is that about 90% of people get exposed to HPV over the course of their lifetime, just because it can spread in so many different ways. And getting that vaccine early helps protect a lot more of the lifetime. Some vaccines work better when you have a more robust immune system, which you have when you're younger, because it learns more aggressively from the things that you're exposed to. And so getting some of those vaccines earlier can actually help with being more protected over time.
Ladies and gentlemen, we're having an interesting conversation with Dr. Andrew Troxell. He's our in-studio guest today on Cape Fear Valley Health's Making Rounds Live. Dr. Troxell, he is a resident physician at the health system, and he is here to discuss the childhood vaccinations, school health requirements, everything that parents and families need to know, getting their children ready for the upcoming traditional school year. Dr. Troxell, we've recently seen confirmed cases of measles here in Cumberland County. The main question I have, should families be concerned?
I think yes, because there's something going on deeper than just the outbreaks that are happening now. And that's kind of the shift away from vaccines as a society. The measles outbreaks may not affect us directly in the near future, but the trend of it is concerning. This is a disease that I really didn't expect to see in my lifetime
Me
in
either.
treatment. It's taught and talked about because it's kind of a scary disease and because we've had such great efforts at reducing its prevalence. Measles is cited as an example of one of the most contagious diseases. If somebody sneezes in a room, if they have measles and they sneeze in a room, that measles will sit in the air for up to 2 hours. If that happens in a classroom at the end of one period, you're looking at 30 kids getting exposed, the next class another 30 kids, the next class another 30 kids. There's kind of a more nuanced scientific topic of the rate of transmissibility of diseases. We call this the R0 value, and it tells you how many people get infected if one person gets infected. So if one person gets measles in an unvaccinated population, the expectation is that they will infect another 12 to 18 people. It spreads incredibly quickly. Looking at flu, COVID, those rates are around 1 to 2 other people. It can double every time it spreads to another person, but nothing near like how quickly measles spreads. And it's something that we have a vaccine for. We've demonstrated the efficacy, how much it works over time, and we haven't heard about it in a while because things were working really well.
Exactly.
Other part of this is that herd immunity works until it doesn't. And there's kind of a threshold where you start seeing outbreaks. So as 5% of people, 10% of people, 20% of people aren't vaccinated, you may not see any outbreaks, but once it crosses that threshold, now each person that gets infected has some room and some space in the community to infect more people, and that's when you start seeing these patterns that we're seeing now.
Dr. Troxell, there's, as you mentioned, and everything is changing, and one thing that I've noticed is that there is a lot of misinformation out there. And what are some of the biggest myths and misinformation that you hear regarding vaccines?
The big top one is connection to autism, and this all came from a study that was published long ago by a scientist who was doing some good research into vaccines. And the research, there were some errors that happened in the lab with how the research was collected. Those errors were misinterpreted as viable findings, and research was published as a result of that. The backstory even is that the physician that was doing this research had some motivation to find concerning things with the vaccine. He was part of a group that had developed a new vaccine to compete with the old vaccine, and so finding that this old vaccine had some dangers associated with it really supported this new financial effort that he was involved in. There has been so much subsequent research into that research, other research around it, that has shown that there really is no connection between these things, and we've been looking at that for decades now at this point. But that myth persists because it's, again, kind of this mystical thing. Why do I have a child that seems like they're doing well and growing healthy and normal, and then there's something that changes over time? And maybe that timing lines up with something that happened, like getting a vaccine, and it's easy to attribute that to being the cause of it. But the research shows that that is not what's happening. Another myth would be that getting multiple vaccines at the same time is dangerous or doesn't work. Part of that may be based on that there are some vaccines that we don't give together, but that's not even related to a safety issue, it's an effectiveness issue. There are different types of vaccines. You can take a little product of a vaccine, you can kind of injure the virus that's in it to keep it from doing bad things in your body, but still allow your body to learn from it. And there's some vaccines that help you target the toxins that are produced by different pathogens. The live vaccines you want to mount an immune response to, but if you already have an immune response going on, you may just destroy it with some of the initial kind of response, as opposed to actually learning from it and building up your immunity over time. And so if you receive one live vaccine and a couple days later receive another live vaccine, that second one may not do anything for your body. It may not benefit you with any sort of immune response targeted at that. So that kind of led to some of this thought of they don't want us to get these vaccines at the same time because they're dangerous. Why aren't we separating out these other vaccines? But the amount of infectious material within vaccines is incredibly low, so much lower than you'd get from eating dinner at a restaurant or breathing air with other people in the room. it's tiny, tiny, tiny amounts, but it's so specific and focused at helping your body respond to it that it can work long term. The recommended schedules have been shown to be safe and effective over time, and there are some that we give at different points in time to kind of reiterate that immune response or to target it towards a period of time when we need the most effectiveness from it. Listening to those schedules is going to be better than a fear response of spreading things out over time.
Ladies and gentlemen, our in-studio guest today on Cape Fear Valley Health's Making Rounds Live, Dr. Andrew Troxell. Dr. Troxell, he is a resident physician at Cape Fear Valley Health, and he's our in-studio guest today. We've got to take a quick break for state news, but when we return, we're going to talk about the science-based information that is out there about vaccines, and we'll continue the conversation in a bit. Cape Fear Valley Health's Making Rounds Live. Make sure you stay close.
We'll be right back with